ASG is the only community-based HIV service provider for HIV-infected, affected people in Central Virginia's predominantly rural area. This 2,200 square mile region, called the Thomas Jefferson District, includes the city of Charlottesville and the counties of Albemarle, Fluvanna, Greene, Nelson, and Louisa. We provide services to people living with, affected by, or at risk for HIV or AIDS. We were founded in 1986 by a group of citizens who were responding to the inadequacy of available care for people in Central Virginia living with HIV and AIDS. 25 years later, ASG is committed to responding directly to the social and medical challenges of HIV and AIDS in our community by implementing our mission of building community for people living with, affected by, or at risk for HIV or AIDS. Over the past 2 decades, our staff has grown into 14 full-time professionals, working together to meet the needs of individuals and families in the Thomas Jefferson District. ASG offers a full portfolio of services designed to facilitate access to housing, mental health care, substance abuse support, transportation, medical services, treatment adherence plans, nutritional information, HIV testing, and risk reduction programming. HIV/AIDS is a social justice issue and is inextricably tied to a host of community ills, including poverty, disenfranchisement, mental health and substance use disorders, and health disparities along both racial and sexual orientation lines. These challenges can only be defeated by the community as a whole, so we aim to strengthen, engage, and build a collective response as a way to provide support to all those impacted by HIV/AIDS. While we have accomplished much, there is still much to do. For every HIV-positive person successfully engaged in the care of their HIV disease, 3 others are not. Currently, we seek to teach our clients the skills they need to thrive despite the challenge HIV poses to their health and to the health of their family members. Our objective is to show our clients and the surrounding community that while AIDS is not a curable disease, it is not a disease that has to radically alter the course of a life. We use the Center for Disease Control's, the CDC's, evidence-based intervention CLEAR. CLEAR stands for Choosing Life, Empowerment, Action, Results. ASG provides the necessary support to keep our clients stable between appointments and increase positive health outcomes by supporting healthy behaviors. Our objective is to increase positive health outcomes among our clients by supporting risk reduction, addressing mental health, and securing stable housing and employment. In the short term, we want to increase our community profile, identify and link more HIV-positive people into care, and increase the number of wellness services we offer, such as community yoga, anger management, group therapy, and job readiness classes. Since access to medical care is not only vital for people living with HIV, but also impacts the community's transmission rates, ASG is exploring ways to establish an access point as an HIV-informed medical home. For many of the individuals and families we support, their only access to medical care comes through specialists or emergency rooms. We recognize that our unique function in the community we serve is the cultural intelligence necessary to guide individuals at every stage of HIV. As an agency, our long-term goal is to significantly decrease the stigma around HIV/AIDS, provide a full range of supportive services for our clients, and to speak loudly on behalf of those living with, affected by, or at risk for HIV or AIDS at the local, state, and national level. Our immediate future includes efforts to intensify our high-impact prevention strategies, expand the number of medical professionals on staff, and train more clients to live meaningful lives in the communities of their choosing. When I came to ASG, I really thought I was there to close the agency. I thought that surely, 30 years into the epidemic and in a community as deeply invested in the nonprofit service sector, there shouldn't be a need for a specific AIDS service organization. During my time with ASG, I've worked to collaborate, integrate, and merge our services with larger, smaller, and same-sized organizations. What I've found is institutionalized stigma so deep that if ASG were to ever shut our doors, people with HIV or at risk of contracting it would have nowhere to turn. No one would help. No one would understand. We help because we remember a time when nurses left meals outside the hospital rooms where infected patients were dying. We still recall a time when resale stores would not take the furniture of individuals who died from AIDS. We know of times when the families of AIDS victims made them eat off of paper plates at Thanksgiving so they wouldn't catch it. Other organizations don't seem to remember those days, or understand that for some people living in rural Virginia, that stigma of the past is the same stigma that is impacting lives in the present. Our dream is to close our doors, but not until there are no new infections and everyone with HIV has a doctor who understands, a nurse who cares, and a place to call home. I hope to be there when we have a bonfire with all the AIDS ribbons, because scientists have found a cure. But until then, there must be places like ASG. We've strongly invested in mental health care access and affordability through a partnership with the Substance Abuse and Mental Health Services Administration, SAMHSA. ASG houses the Community Mental Health and Wellness Coordinator as a part-time employee to increase access to mental health and substance use services for our clients. Individuals living with or at risk for HIV or AIDS live with a higher risk for depression and other mental illnesses than the general population. ASG is the only AIDS service organization in Virginia to engage with SAMHSA to tackle HIV treatment and prevention from a mental health perspective. We recognize that undiagnosed and untreated mental health and substance use disorders increase HIV risk and the likelihood that infected individuals will fall out of care. And when that happens, they are more likely to transmit the virus to others. ASG has also invested in positive behavioral health outcomes through programming that helps increase self-esteem, self-confidence, and social confidence in people with HIV/AIDS. Wellness programs at ASG, such as our yoga meditation practices, anger management groups, and workforce readiness classes, increase social support and give them the tools they need to realize their dreams. ASG is uniquely positioned to help people assess and manage their risk for HIV through our community HIV testing program and through our strong relationships with other community mental health and social service providers. As the only organization in a 100-mile radius specifically focusing on people living with HIV or AIDS, PLWHA, we recognize the unique role we play in our community as the one place many of those we support feel safe enough to discuss their health status or talk about the behaviors putting them at risk. As a 25-year-old organization, it would be easy for us to just continue the same practices of the past. But our board, staff, and even the families we serve understand that HIV is an evolving disease, and ASG has to remain nimble to remain effective in our practices. ASG has worked diligently over the past 18 months to modernize our programming to fully reflect advancements in HIV prevention and care. Specifically, we've worked with the CDC, the Substance Abuse and Mental Health Services Administration, SAMHSA, and the American Psychological Association to ensure that we are meeting the highest programming standards. We've explored all avenues for blended income streams. We are the first organization in the Commonwealth of Virginia to apply for a Medicaid license for behavioral health services targeting PLWHA, and the first in the country to train an entire staff on the evidence-based intervention CLEAR. We are confident that we are positioned as a sound investment for both private and public funders. Our development plan includes significant efforts to establish new funding streams, including accepting insurance, as an effort to be sustainable beyond grant income. ASG takes its responsibility to our funders, clients, and community as our highest priority. We document success on client, organizational, and community levels through a variety of metrics, including surveys, rigorous policies and procedures, and community attendance and interest in events, such as the annual AIDS Walk. Client success is documented by the completion of our intervention program, CLEAR, and other wellness courses, as well as adherence to medication and care regimens. We also distribute comment card responses that ask our clients, in their own words, to rate our progress. These metrics keep us operating as a safe, open, professional, and knowledgeable organization. In 2010, ASG completed the first full audit of our practices since our inception. The result was a complete restructuring of our staff, funder relationships, and services. As PLWHA began living longer, the palliative model of services became obsolete. We needed to reorganize our agency to help those we serve develop appropriate life skills to manage a life with HIV, or for our negative clients, to develop the skills to remain negative for a lifetime. We combined staffed positions where possible to integrate services and erase the dividing line between prevention and care. We adopted cognitive behavioral practices so that all clients, positive, negative, or affected, would receive the same type of services. To measure our successes and challenges, and to establish quality improvements, we hired a program accountability manager and an external evaluator to develop and monitor best practices. The most recent data collected has identified significant barriers in our community for access to and maintenance in care. We hope to address that through developing an HIV-informed medical home. We continue to live our mission every day, and one of the strongest indicators of our program's success is our clients' ability to graduate from client to leader. In our Project Thrive, a group session based on self-management principles, many of the participants move from attending sessions to leading sessions. Our client-focused perspective provides those we support a working space to develop their own skills and talents. The community of those we serve becomes the arbiters of the caliber and tone of our services. Many people are surprised to learn that ASG serves 10 times as many HIV-negative individuals as positive ones. We help people manage their risks through one-on-one risk reduction counseling, education, and of course through our CDC life coaching program, CLEAR. We are heavily involved in leading the Community Mental Health and Wellness Coalition as both the fiscal agent and the home of the coalition coordinator. We're proud to have stepped away from the AIDS-specific tables to bring the issues our clients face into the mainstream in the areas of mental health, substance use, and medical providers. Many people also think we only work with people who are living with HIV and living in poverty. Too often in our past, we only focused on the individuals most in need. Our services were disjointed. We provided testing for individuals who were at the beginning stages of grappling with HIV and were dependent on state-assisted programs. We did not offer any other services until someone was homeless, had turned to using substances, had been abandoned by a loved one, or had developed advanced AIDS. When we performed our organizational review in 2010, we recognized an ounce of prevention was worth a pound of cure. Then we restructured our programs, sought new funding, and began to truly engage anyone who needed a safe place, regardless of their economic status. We concluded that finding newly identified HIV-positive individuals and immediately engaging their families, addressing any mental health and medical health issues, and securing housing and employment was a significantly wiser use of funds and would ultimately produce more effective outcomes. When the impact of the HIV epidemic began to be felt in rural central Virginia, ASG was the only local organization to effectively respond and combat the effects of the disease. When nurses at the local hospitals would not bathe people with AIDS, our founders were there. When families threw people out of their homes, we took up a collection to pay their rent. When people couldn't shop for themselves or clean their homes, our volunteers were there. Our founders provided rides to doctors, cared for pets, or even held the hands of people in their last moments of life. We have maintained that legacy for over 2 decades. Regardless of funding streams, we have always found a way to provide thousands of people with a safe place to manage their disease and their lives. We've helped individuals and families face mental health issues, substance use, or other coping behaviors that are putting them at risk for HIV. We've made countless doctor's appointments and have coached many individuals on the importance of adhering to their medications and facing their disease head-on. We've provided housing to hundreds of individuals and families, and in death, we have helped PLWHA face it with dignity. Following death, we're there too, counseling survivors and assisting in the grieving process. More recently, we've turned our attention to helping PLWHA live full, meaningful lives despite HIV. Whether it is a young man being released from incarceration, a young mother trying to prevent transmission to her unborn child, or a widow entering the dating scene again, ASG is the one place where these individuals who are experiencing such unique challenges can find a sense of community to face those challenges. HIV stigma is one of the most significant barriers to ending AIDS. In the rural South, we know that stigma, not AIDS, is responsible for most deaths from HIV. We know that stigma, shame, and fear decrease the quality of life just as much as harsh medication regimens, opportunistic infections, and mental health complications. Like many ASOs, our future is uncertain due to both fiscal and cultural realities. As HIV becomes recognized as more of a chronic illness, requiring a lifetime of disease management practices, the funding which was once available to ASOs is more and more limited. Plus, serving remote populations of individuals with HIV can present specific challenges with transportation, as well as access to high-quality, culturally appropriate care. Perhaps more concretely, the restrictions on funding at the state and federal level, which target certain populations or place limits on who we can serve, will never truly allow us to craft an effective, community-wide response to ending the impact of HIV in our local area. HIV is perceived as being less of a threat to community health than it once was. This has, unfortunately, changed our visibility in the community and the community's response to those we serve. Here in rural Virginia, the stigma associated with HIV is the same now as it was 20 years ago. Based in ignorance, this stigma is responsible for ruining countless lives. ASG continually develops innovative responses to apathy and stigma. It has most recently been active in moving beyond the closed conversations among ASOs and is beginning to engage other strategic partners. Stigma reduces a person's decision to have routine HIV testing, and that in turn limits our work with positive individuals on learning appropriate disclosure, as well as finding access to and maintenance of their care. As the most northern of the southern states, Virginia is often not included in specific funding opportunities associated with healthcare in the South, even though those issues are very much present in Virginia, too. ASG has many targeted goals that will only be made possible with additional resources. Priority in the short and long term is to increase our services to individuals living with, affected by, or at risk for HIV or AIDS. We want to expand our scope and provide more mental health services, more in-home services, and more programs that support our clients and their families. ASG is growing fast, and we need a bigger space to accommodate our programs, our staff, and our clients. Ideally, our new building will raise both the profile of ASG in the community, raise awareness about HIV and AIDS, and remind Central Virginia that we're here to offer support to those living with, affected by, or at risk for HIV or AIDS. While the Charlottesville area is rich in resources, few of them are available to PLWHA. Many of the publicly funded programs addressing HIV and AIDS, like Ryan White, were structured to respond to the AIDS crisis of the 1990s, when the lifespan between diagnosis and death could be as little as 9 months. In our rural region, many of these resources are locked into larger hospital systems that are not nimble enough to respond to PLWHA with the support they need for living a normal lifespan with HIV. 15 years ago, access to an infectious disease specialist was a primary concern. Today, having a primary care physician with a working knowledge of HIV is more cost-effective and provides increased positive medical outcomes for PLWHA. While there are 2 national accrediting associations for primary care physicians specializing in HIV, there are no certified providers in our area. ASG envisions developing a medical home for HIV-informed primary care as a more efficient and sustainable response to the current state of the HIV epidemic in our area. In addition to the lack of HIV-informed primary care, Charlottesville and the surrounding counties are experiencing a long-term mental health crisis. Access to affordable mental health care for people with mild to serious mental illness is inadequate. Hiring a mental health clinician and getting involved with the Community Mental Health and Wellness Coalition is one way ASG has tried to close this gap. As the only AIDS service organization in a 100-mile radius, ASG often receives many questions about available services. Recently, we received calls from sexual assault resource agencies on behalf of assault victims who were harmed by HIV-positive individuals. These agencies were inquiring if we could provide post-exposure prophylaxis, PEP, a short-term drug regimen that decreases risk of HIV infection after exposure. Unfortunately, we have no capacity to fund medical care for individuals in this way at this time and can only provide counseling. In establishing ourselves as a medical access point for primary care, we would be able to more closely link medical services like post-exposure prophylaxis to our current portfolio. Additional funding allowing us to provide clinical care with doctors and nurses on staff would enable ASG to more closely link the medical needs of those we serve and help reduce the community's risk of new HIV infections.